Hello, everyone. Welcome to another podcast show. Artificial intelligence, AI, everyone is talking about it. I personally believe that it is going to affect healthcare and the practice of medicine in ways that we cannot even imagine. Healthcare is going to look completely different within probably 2 to 5 years. I hope for the good. Maybe there will be some bad thrown in as well. That is what we are going to discuss. Artificial intelligence and its effect on all of us, especially you as a patient.
So I've seen, quite a few innovations over the years in healthcare, and there's been a lot of promises. So we had the electronic medical records, and there was a lot of promise there. It was going to kind of change the landscape of medicine, and the communication was going to be 1,000 times better. I heard of home healthcare, where people were going to go out to the homes, and the hospital was going to be in your house. I heard many different innovations, and I got to say almost all of them fell short of what they promised. This is the first time I have seen anything in the healthcare space that I've seen said, "Oh my God, this is gonna turn healthcare upside down."
I agree, Ben, and absolutely. I think we often underestimate on how exponential AI is going. We say 2 to 5 years. It actually could become much faster. I mean, they say what AI does in 1 to 2 years is what it took the iPhone to do in 20 years almost. And
it's very true. Yeah.
I mean, it is going to completely transform the patient experience and hopefully for the better.
Absolutely, yeah. And I know that many people, because I've talked about AI, many of you have probably seen my previous videos, how it's coming. And of course, we always have to be careful with technology, but I don't think that we should look at it necessarily through the prism of good and bad. Yes, there will be some bad involved. I think that the reality is that AI is absolutely going to take over large segments of healthcare, particularly certain specialties. And it's something that is going to be there. And it's very different from other technology. I also believe that the natural human tendency, probably an intrinsic survival mentality, is to always have a bit of fear towards anything new. I remember reading stories that when the bicycle was first invented, many people were outraged and said that this is an absolute evil that people are using the bicycle.
Same with seatbelts. People doubted seatbelts when they first. But it is going to, the whole patient experience, I'll get back to that again, because there's so much frustration in medicine. So yeah, you're right. People get afraid of new technology. You can embrace it or ignore it, but it's going to be coming. And I think used in the right fashion, I think a lot of the frustrations in healthcare might get dissolved, right? What do you guys think?
I actually want to tell a story that's Suneel's story, but I might steal it.
Stealing my story?
Sorry, might have to. But so it was, I think, one of your family members or a friend, and they had some medical condition. I believe it was a rash or something. And they actually took a picture and put it into ChatGPT or into one of the AI apps. This thing was able to diagnose what this condition likely was, spit out the labs this person should get, and then recommend potential treatment options depending on what this person was diagnosed with. I mean, that's what we do. So you're talking about a system that can, in seconds, diagnose a patient, give them potential treatments, and do it all hours of the day and night. I mean, this thing will never get tired. It'll never, tell you it's 2 a.m. We're not available. I think it has the potential to completely upend medicine, but in my opinion, in a very good way. I think it could be something that, we have a huge access problem when it comes to healthcare. And I think this is something that could upend that and help patients dramatically.
Yeah. And I'm going to interrupt for a moment to say that everything you've been watching so far has been AI generated. This is not actually me talking. Yeah. Okay. No, it's me. All right. Well, I have a lot to say about that. Yeah, it's definitely me, and this is definitely Ben, this is definitely Peter. And firstly, thank you, Ben, for watching my videos. I didn't know you did. I thought you thought my videos were horrible.
I still think they're horrible.
Peter thinks they're horrible. Well, thank you for watching. Yeah, absolutely. Many of you may have seen that video as well. So basically, a very close relative of mine actually was in the United States. I was overseas, and by the time she contacted me, said that she had already plugged her rash into AI. picture sent and had got a perfect list of differentials. And I was thinking, my goodness me, no specialist could give you such a perfect list. And then she went and got labs done, and thankfully the rash resolved. But I really think that when it comes to the healthcare shortage, when it comes to the fact that there will be better and better AI programs over time, that this is very much the future. I'm actually already seeing this in hospital. Patients are getting answers from AI, and it's very different from Google. I do want to mention, I think you might be able to talk more about this. I've seen a lot of comments from people saying, who is programming the AI? It's not like Google, because actually it's not programmed like that. It's you want to explain that a bit further? Yeah.
Yeah. No, I mean, it is, and you're right. I mean, I think in the right hands, and, I think a lot of people are using AI maybe for fun now. And I think people probably definitely don't know the wave of how it's going to change healthcare. And the whole, coming into the office, the whole checking in process, wait times. I mean, doctors will be able to see more patients because, right now AI, and it is going to dramatically improve, is really good at doing mundane tasks.
Absolutely. And hopefully spend more time with patients.
Yeah. So what would be great, guys, if
that's what we
walk into our room, we don't have to sit behind a computer at all, and we leave there and our note is already done. And I think that, patients may not realize this, but after every patient, we have to go to usually a clunky computer. And create this note that, essentially sometimes feels like it's an insurance document and not actually like a doctor's note.
Oh, absolutely. I think there's already, I think they're already doing this in Norway, where they have, it might be through Epic, I'm not sure. But what it does is the AI consolidates all the notes and labs and everything that's been done on the patient over their entire life or entire time that they've received medical care. And it puts it in a concise summary for the doctor. Now, truth be told, the medical records we have now, they're not very good at compiling all your data, putting it into a succinct summary so that anybody could follow it and know everything that's ever happened to you. I mean, how many people out there, how many of you out there have gone to your doctor and had to remind them, hey, you remember I had this, or you remember I had that? And the doctor pretends, oh, yeah, I totally did. But they probably don't. Because, the medical record is enormous. It's hard to get to everything. And not just that. I mean, think about, it could summarize how many interactions your meds could be having with each other if you're taking a lot of medications. I mean, it's unbelievable. And
this is all instantaneous. I mean, this seems like a huge process, what you just described, but this is talking about, 10 to 15 seconds of AI. Exactly. Not only like screening through every entire medical record, every imaging, every test. It's going to pick up stuff that doctors have missed, right? And so
I think so. And you will see it first, which is a great thing.
So I mean, I've seen, I can't tell you how many patients I've seen that they've had. A lot of people will get these like low dose CAT scans if they've been smokers, and it's really checking to make sure their lungs are okay. And people have these CAT scans, and I see these people a few years later, and I'm like, wait a minute. In the middle of all the verbiage and everything that's on there from the radiologist, there's one little line that says coronary artery calcifications, which is essentially coronary artery disease. And for me, that's hugely important because now the patient's had that for years, not been on the right medications, but those, I can't tell you how much that's missed, because a lot of doctors, and rightfully so, they order a test for a reason. And so when they look at that test, they're looking at the stuff that they order it for, not necessarily everything else. That's where AI, I think, will be really effective. That's true,
and it cannot be overstated how much of a doctor who works within the system, how much of their job is administration and filling out tick boxes and writing charts, which they have to do. I mean, I work in a hospital, and these things have to be done. If you work within the system, you have to write this note. And I always use the example 30, 40 years ago, back in the good old days, before our times actually, but back in the good old days, it was 15 minutes with a patient and 5 minutes scribbling a quick note. And that's completely flipped to 5 minutes with a patient and 15 minutes writing the note. And my big hope, my immediate hope in terms of doctor workflow is that AI is really going to help with these bureaucratic necessities when one has to work in the hospital. I want to talk a little bit about my thoughts about how this is going to be a really well-deserved shake-up for the medical profession. which I believe has failed on so many different levels. Patients are not getting the care that they need. I know millions of you are suffering. And the system that we previously had in place, where a doctor may have a paternalistic role, is going to be shaken up so much by AI. Yes, of course, there'll be bad sides to AI as well, but I'm very optimistic that super fast, more power is going to be given to you, and you will have more access to records, and you'll have more options. And to be quite frank, a lot of the time, you will know exactly what needs to be done with a certain set of symptoms, lab results, and imaging results.
And I keep focusing back on the practice and the patient experience in the office, and if we could try to like create what that would be. So I mean, when you call an office now, most offices and hospitals, everything have these outdated phone systems that are going to seem really outdated really fast, right? Leave a message for this person, press 1 for this person.
Yeah.
You're going to have, AI will take it over and completely tailor you to the right response. I hope that's the hope.
It's not going to be a frustrating, I wouldn't be so hopeful if it was going to be a terrible experience just with a robot or typing. But as you said, Peter, hopefully AI can be more tailored and you can get what you need faster.
Yeah, I mean, secretaries can deal with problems and direct them more accurately based on the responses from AI. I mean, we have a lot of redundancy in the system. You get checked in. There could be a medical assistant. They're asking all these questions. They're looking at your medications, any changes. I mean, that all, in conjunction, with someone can really just transform and make that like instantaneous. So when the doctor comes in, you're ready to see, and you don't have to kind of repeat yourself again and go through, everything is just there. And there's no more of this like us coming in, we talk about like that patient triangle where we're supposed to have like the computer screen here, the patient here, and the doctor here. I mean, that's how ridiculous, mess it's become. We're told this. I mean, that's not something you taught me in medical school. Yeah. And it's so frustrating to have to like move the screen away. But now I can just walk in, talk, do my thing that I was trained for, and I can walk out, and I don't have to really
be with the patient face to face and having that interaction.
The time saved that you can spend more with the patient with that.
Well, here's a question. So as a diagnostician, I mean, that's a lot of what you do as a primary care doctor. If this thing can do it better and it can do it more efficiently and it's right a fair amount of the time, is there a point where doctors become, certainly outpatient doctors become unnecessary, where the system can do it better? I mean, is that on the horizon?
I think that's really debatable.
It's a big question.
There is something about the human touch of medicine, and maybe that's outdated. And it's that feeling you have with a patient, that connection, and I think that definitely be lost when you get to know patients and I don't know. I mean, I don't know what to be like in 5 years.
I mean, I think that these are excellent points. Yeah, I mean, and the bigger point here is that. To me, and I know to both of you gentlemen, being a doctor is a special job. There's a sacred patient-doctor interaction, and my primary hope is that the AI that is going to sweep in is going to help patients with issues that they can't get help with, but also help the good doctors within the system navigate everything better and not have so much bureaucracy. Now, I do think, and this is again coming back to the medical profession being shaken up from its core fiber, which is in the wrong place right now, that this is going to quickly sort out the good doctors from the bad doctors. Because the natural question is, if AI is doing this for me, why would I want a robotic protocol following doctor? Why? I want to see a good doctor. I'll happily see a good doctor who's going to look me in the eye, show empathy and compassion, display those soft skills, talk to me about my options, and treat me like a human being.
Yeah. And the doctors that don't have those skills will be filtered out.
They're on their way out.
So you can make an argument that this will drastically improve the patient-doctor connection.
Yeah,
that's interesting. That's very positive.
It's going to enhance the experience.
Exactly. I mean, what specialties do you gentlemen think are in trouble? I mean, I personally think primary care is going to be one of the first affected. There's certain specialties like radiology, pathology, dermatology. I can see no scenario where AI won't be better than a human eye at looking at scans. I can't see that. You will probably need somebody medico-legally overseeing it, but why?
You're absolutely right. I mean, there've already been studies that showed that computers and robot algorithms can look at radiology films and have a higher accuracy than radiology. I mean, I think it's going to be used as a tool, at least in the beginning, but as time goes on, if it's better and more effective, the oversight might start to go away. I mean, to a degree.
Which is a natural progression. Everybody wants oversight at the beginning, and then when everything is okay.
I'm a patient too. I mean, I'm going to get sick too, and I want to know that I'm getting the best care possible. I would prefer a machine that didn't make mistakes. If humans make mistake, to err is human. So I think to know that there are better safeguards in place, to know that the machine works better, I'd be okay with that. Even though would change my the way that I earn a living a little bit, I'd rather be healthier.
But imagine him as a great bar owner, by the way. So he will have other options when
100%.
Well, AI takes over.
I just take money from you.
You referred it to as a machine, and I think maybe that's what people still think of it as like it's going to be like a robot walking in, and it's going to have its limitations. And I think like we don't even know like there's no boundaries with AI. That's a little scary too. And I think that's why we have to make sure it's, we have to embrace AI, but make sure it's really regulated in healthcare. And hopefully
that's certainly
doctors will, unlike other things in healthcare, like stick up for themselves and make sure that it's used appropriately for patients and not, in place of just the turnover of patients and seeing more patients without improving healthcare. And I think if AI improves healthcare, I'm totally for it.
Yeah. Oh, absolutely. So let's move on. So I think that this could completely happen within the next couple of years. I think the medical profession has no idea the train that is heading towards it. And let's paint a picture of what your healthcare, because you're the important ones here, what your healthcare might look like in 3 to 5 years' time. How will things be different from how they are now?
That is
Ben will be gone, but
fascinating. I'll be gone,
but you'll be owning your bar, right?
So
they'll still be used for good doctors. Of course, they will. We'll probably be more busy.
Yeah, I don't think so. But I could very much see, anyone with any kind of problem, going in front of the computer or whatever it is, interfacing, explaining their problems, and quickly getting a treatment plan spit out to them. I could see primary care visits maybe changing in the way that they exist now. Maybe there'd still be physical exams. Maybe there wouldn't. Maybe there'd be technology that could do that portion of it. But I think people would get I think what would change most dramatically is you get very rapid care and good care.
And a good opinion, really
and a good
quickly.
Opinion and access. So anytime, right now, you have a question for your primary care doctor, good luck. Maybe they get back to you in a week, maybe they don't. With this, they get back to you in seconds. I mean, this thing would get back to you in seconds. And if
with a great answer,
it needs guardrails, but once it's done correctly, I mean, it could be honestly very freeing and wonderful for patients.
Okay, everyone, I'm going to interrupt this fantastic discussion for a moment to tell you about our amazing expanding natural supplement store, my uniquely formulated natural supplements. We have immune support, bone support, memory support, heart support, and sleep support. Links down below. High quality supplements. We're very proud to be made in the USA, and we work with a veteran-owned company. I'm also very excited. Keep an eye out for this. Our upcoming organic chai tea mix, based on the tea that I've been consuming for many years, a health and well-being tea. ohighwellness.com if you're in the USA, North America, ohighwellness.co if you're in the UK, Europe. Check the links down below. Okay, back to the discussion.
The access could be amazing.
It brings up that actually, but it makes me think about we're kind of focused on primary care in offices, but think about urgent care or more the emergency center. It's more like trauma or acute care patients coming in where, a lot of times it's like checking off the list of things to, and so someone comes in and, AI, assists the emergency room doctors in ruling out things extremely fast in seconds, which would take probably an hour or, if not more. Just every time we get the blood work back, all this stuff. So
such a good point, Peter. And where most of the misses that occur in medicine are, it's because people didn't follow protocol.
Yeah.
And it's hard for a person to do the exact same thing over and over and over, especially under duress.
Yes.
Right? So when you're nervous and you're excited and you're treating somebody sick, you can move too quickly. This thing never will. It'll do the same thing every single time, no matter what.
True. And this is a great point, actually, because protocol there's two sides to that coin.
There is.
Yeah, exactly. Because yes, we have protocols that exist for things like surgery, just like flying an airplane. You can't just go and do random things. You have to go about it in a methodical way. But this is actually a great point, because I think that protocol-driven medicine, tick box medicine, is one of the worst things that has happened to people, and has not allowed doctors to treat patients with common sense a lot of the time. And how do you see that playing out? Because I still think the good doctors will be the good doctors. They'll be in demand, and everybody will know who the good doctors are and who the robotic doctors are.
That's right.
But how do you think it will play out? Yes, we do need some protocols, but in terms of will AI lead to more protocol medicine, which in many ways is not what we want?
So it's possible that it could, but I would say there's a caveat to that. So there are scenarios, and there are a fair amount of them, where protocol driven, or at least going through some sort of algorithm, is appropriate every single time, no matter who you're approaching. Now, then you will get to a point where you have to use judgment and know the person and figure out what's going on.
Give them the option.
So I think if you can marry the human aspect to the protocol driven aspect, you could, we call them guidelines, and that's what they are. They are guidelines. They don't tell you exactly what you have to do every single time. They guide you a lot of these things. You still have to use your judgment. I see people all the time that look like they're a certain diagnosis, and then you start talking to them and realize it's something very different, and they're nervous and they're scared, or they're having problems
at home.
A human, and it's something very different, and I identify with that, and we figure it out together. But I think there's still going to be a place for protocols.
I agree. How many patients do you, like, even before you see them, or read their chart and you see them and they look so much better in person than on paper, right?
That's one of the compliments I frequently give my hospital patients. Oh, you look much better than I was expecting.
Better than what we wrote.
I know. And that is the human connection. But, I'm kind of fascinated, actually, more that we're talking about it, is because you guys are medicine, I'm cardiology, but like surgery, actually. If you think about AI, and that's really where protocols are probably more important, like checking it's the right patient, the right side of the body and stuff like that. It'd be, but also like a lot of people having robotic surgery. It's called the Da Vinci robot, laparoscopic surgery. So if you have AI that really knows every single variation possibly known on human anatomy, and identifying.
That's interesting.
I think that's where, like, that repetition. I think that's where AI and protocols probably will stay in place. And because I think that's just so fascinating, right?
Yeah, it's fascinating. We're in uncharted territory, and there has not been a technology like this that I can think of, which is changing so fast and growing exponentially. Let me paint a scenario to you and get your thoughts on this. So let's just say you have a typical minor to mild condition, and AI reaches a point where literally you can put some pictures in, maybe even like breathe in front of it. I mean, there's so many ways this could go. And then you maybe could get some labs done remotely, and then it could plug out a diagnosis for you. Then it could recommend medications, and it can tailor it to your history and what's appropriate, present you with the options, you decide what to do. Would it be a stretch to say, well, why not bypass the doctor then completely and have a pharmacist maybe overseeing it at first, if you know what the diagnosis is and the technology gets so good that 99 out of every 100 people have an amazing experience? Why would you even need the doctor?
No, I actually think that's very possible. I think that is a possible scenario, that's what happens. I think the other portion is what Peter was talking about earlier. There is an importance with the human connection, and there are things that humans see in each other that we realize and recognize needs something else. So as you said, I think there is going to be a place for good, empathetic doctors that make connections with patients and earn over time the patient's trust, and so that they work together with the AI to help them and make sure that, any mistakes that are possible aren't made. So that's a way that this could merge, and there could be a future for good doctors to be part of continue to lead the charge in terms of the treatment.
Yeah, I mean, it's going to, we talk about like loss of follow-up in COVID during the pandemic. I mean, that was huge. I mean, think about the backlog of everything in healthcare where you can't get a hold of your primary care or in some cases, I guess, cardiology. But you can't, actually, patients can't get into communicate with anyone actually in healthcare right now.
It's so sad.
No,
we feel for you. We see what's happening.
I think we always talk about there has to be a change in healthcare. And I personally think that AI is going to be that change, for the better. And I actually think there's a lot of good-hearted doctors and people, and people above who are not always the doctor's favorites, but an administration who really understand that this will improve outcomes on patients. Exactly. I think it's something that I think it's something that we need to embrace.
Yeah, there are.
And I think if we don't embrace it, someone else will.
That's where we get the issue.
I
personally think doctors should be embracing it. Most doctors I know are hopelessly blind to what is about to happen and what's already happening. I mean, these AI programs are magnificent already compared to technology that used to exist. And we just have to make sure that we use it in the right way and to aid us. And at the end of the day, it's an immensely personal field, healthcare. And we want to maintain that doctor-patient interaction, but use AI to help augment everything else and ultimately get you the diagnosis faster and get you the treatment faster.
Exactly right.
Yeah.
Let me just say one more thing. If we know the system is so broken and the care we're delivering is so poor, why not explore something that might make it better?
How could AI be worse?
Why not try?
That's right. So let's wrap up then with final statements here and more advice for you on what you should be thinking with AI. I personally think that whether you think it's good or bad is somewhat irrelevant. It is here and it's going to be embraced by millions upon millions of people within the next couple of years. So what we have to make sure is that AI is used correctly, understand the new developments, and go online, listen to what's going on, how people are using this to navigate a system which is absolutely terrible, to get a diagnosis faster, to go even outside of the system. I mean, why not? The system is so bad. If it's failing you and AI can do better, then use it. And obviously when something needs to be discussed with a doctor, you can. But I would really urge you to be open-minded on this and understand that your healthcare, because of AI, from both your perspective and even the doctor's perspective, is going to look very different in a couple of years, but you are going to be more empowered. I can't see it working any other way than more decisions being left with you, you getting more information, everything being much more transparent, and you can tailor AI to your own wishes. You can even ask AI now, I want to explore natural remedies for XYZ. Give me some options. I'm worried about side effects. Compare this drug with this natural therapy. What are the pros and cons? It will give you way better answers already than any establishment doctor. And we're only at our infancy. This is a game-changing technology. A train is rushing towards the medical establishment. And I think the medical profession is going to be shaken to its absolute core. How do you feel? Closing statement.
I agree. I mean, I think the key here is to learn the AI tools, get familiar with them because they're here to stay. But the most exciting thing is I think we should make another video podcast about the same topic in a year from now.
That's a great idea.
Exactly what we changed.
It's going so fast, maybe 6 months.
Yeah, 6 months is going to be exponential.
Yeah. Or we could just have AI do it.
It'll just be AI doing it instead. All right. Any final thoughts, Ben?
I think the future is bright. I think healthcare needs this. I think that patients need this. I think it is going to be one of the few technologies I've seen come around that is going to upend a broken system. And I'm very optimistic. So.
All right, everyone. Thank you for watching. Take care, stay healthy, and we will see you again next time.